Welcome to my new and improved series on BPPV. My name is Amy Moore and I'm a vestibular PT, which means I treat vertigo, dizziness, and balance problems. This is part one where I will answer the question, what is BPPV? If you see a question you would like answered here, go to the BPPV playlist on my profile and click the corresponding part. BPPV stands for benign paroxysmal positional vertigo, and it's often referred to simply as vertigo or crystals in the ear. It's important to note that vertigo is merely a symptom, that is a sensation of turning, rolling, or spinning. So if you have this symptom, it can have many causes. Although there are several conditions which can cause the symptom of vertigo, BPPV is by far the most common cause. In fact, it is estimated that BPPV is the cause of 26% of vertigo sufferers. So if you get vertigo symptoms, statistically there's a 1 in 4 chance that the cause is BPPV. If you have vertigo, it's important to go and see your doctor for proper diagnosis and treatment, as the contents in this playlist are general education and should not be considered medical advice. So let's get into it. BPPV occurs inside the inner ear. When I say the inner ear, I mean part of your ear anatomy that cannot be seen by an otoscope or accessed by a Q-tip. If you dive into a human ear, the first thing you'd see is the eardrum, which is a thin flap of skin that's supposed to seal off the external ear canal from the outside world. Behind the eardrum is the middle ear, which is a space with small floating bones important for hearing. Behind the middle ear is the human skull. The inner ear is located inside your skull, more specifically, embedded inside your temporal bone. It is not open to the outside world, and it is filled with fluid from your lymphatic system. You can think of each inner ear as your body's motion sensor. You have two inner ears, a right one and a left one, because they balance one another and tell your brain what position you're in and what motions are occurring at any given time, similar to a level. Your ear crystals live inside your inner ears and are a valuable part of your anatomy at birth. Yes, everyone has ear crystals. Ear crystals is actually a slang term. They're actually called otoconia or otoliths scientifically. You need them to be able to sense motion. Specifically, they are located inside this main sac and should be adhered down to a sticky membrane at all times. BPPV occurs when crystals get crumbly or dislodged from their sticky membrane and go tumbling into the neighboring canals. When this happens, the crystals displace fluid, causing a hyperstimulation of that inner ear, aka your body's motion sensor. And because the other ear is giving off normal signals, your brain will often interpret this as vertigo or spinning sensations. Because the hyperstimulation only occurs when the crystals displace fluid, the symptoms will usually only come on whenever the head is in motion or when you perform a large position change such as looking up, bending over, laying down, or sitting up from bed. The good news about BPPV is that it's fairly simple to treat and that generally the prognosis is good to make a full recovery. Follow along with this series to get all the information you need and all your questions answered about BPPV. Oh, and hit that follow button for more great information, tips, tricks on all things dizziness, balance problems, and vertigo.